Hello all, welcome to my channel. Today I will be explaining basal metabolic rate BMR, which is useful topic for nutrition and nursing students. Human body needs energy on the daily basis to carry out various activities. Energy we need on the daily basis. So total energy which we get through the food is utilized for doing the physical activity which is listed under the voluntary activities, like the activities which are in our control, like doing everyday activities, cycling, dishwashing, like that various activities we perform which are listed under physical activities. And we also need energy to carry out involuntary activities. So our body needs energy for the involuntary activities, and that is known as BMR. So most of our energy we consume is utilized by the body for the BMR activities. That is the amount of energy required by the body to carrying out involuntary activities and maintaining body temperature is known as BMR. So BMR is a number of calories your body needs to accomplish its most basic life sustaining functions. So uh, from our total calories, most of the calories will be utilized for the BMR. So which are the involuntary activities? So energy is utilized for functioning of various organs such as functioning of the heart, process of circulation. The kidneys also utilize energy for doing the process of excretion, breathing, cell production, nutrient processing. So all these activities under nutrient processing, carbohydrate, protein and fat metabolism, all these activities are the processes which our body undergo utilizes energy. So the BMR is all the sum of various activities our body performs, which are called as involuntary activities. So basal metabolic rate is often used interchangeably with resting metabolic rate. RMR and BMR are used synonymously, while even BMR is a minimum number of calories required for the basic function at rest. At rest, RMR is also called as resting energy expenditure. Means when we are into rest, means we are not doing any kind of physical activity, we are into sleep, we are in rest, still our body utilizes energy for the involuntary activities. So that is called as energy expenditure at rest. Resting energy expenditure is the number of calories that your body burns while you are at rest. So although BMR and RMR is slightly differ from each other, your RMR should be accurate of your BMR. So BMR, RMR should be resting energy metabolism should be similar to basal metabolic rate. So the total energy requirement of the human body uh, is divided into different activities. So firstly, most 70% of the energy what we get on daily basis, if a person is consuming 2000 calories diet per day, so 70% of the calories from that is utilized for the BMR activities, and total calories per day used for the physical activities plus specific dynamic action or to maintain the thermogenesis. 10% of the calories on the daily basis should be kept as extra. So including BMR, physical activity and specific dynamic action will provide us total energy requirement of the person per day. So how to estimate the BMR? So while knowing BMR is very important in order to decide the total calories of the person. So we need to estimate the BMR by using very simple formula, and uh, if it has to measured by undergoing test, in the test it consists of measuring the amount of oxygen a person consumes and carbon dioxide exhaled in the particular amount of timing. So in that particular amount of timing, a person's uh, inhalation of oxygen and exhalation of carbon dioxide may be measured. So through that BMR can be measured. Otherwise BMR can be measured by using simple formula. Students can calculate BMR by using this formula to decide the total number of calories per day. So formula is like this: for the men, 10 into their present body weight plus 6.25 into heights need to take in centimeters minus 5 into their age plus 5, and same the difference in the women is here minus 161. So most of the students use uh, for the practical purpose and all, we use this formula only to measure the BMR, which give you accurate uh, BMR for the persons, because we are considering here height, weight and age of a person is needed for calculating the BMR. Now what are the different factors affect the BMR? Means when BMR increases or decreases. So how to cope up with the increase or decreased BMR in the body? So when there is increased or decreased, health status of the person will be affected. So BMR affects with the body size. So heat is continuously lost through the skin. A tall, well-built person have a greater skin surface area than the shorter or smaller person and loses more heat through the skin. Hence, the BMR is high in the uh, person who has a larger body composition, body size. Body composition, BMR is higher or good BMR is seen in the person who has lean mass, and BMR is slow in the person who having high amount of fat. So body fat decreases BMR. Lean body muscle, a person with a good muscle have the good BMR. So the person will be active with a good BMR. So age, as per the age, during the period of rapid growth, BMR increases by around 15 to 20%, because growth hormone stimulates the BMR, and BMR usually will be high during the infancy or growth years, which is high during puberty, and during pregnancy and lactation BMR will be higher. So gradually the BMR declines with the age, 2% for each decade after the age of 21. As a person ages, so gradually BMR declines. So gender, the BMR is said to be 10% higher in the male as compared to the females. That's why we do the minus 161 calories for the female in the formula, and only minus 5 in the male for calculations. So during some metabolic conditions like fever, in the fever, as the body temperature increases, BMR also increases by 7%. Each increase, fever increases BMR for each degree Fahrenheit, 7% rise in the BMR. And when BMR is higher, energy expenditure will be more. So during some hormonal disorders, BMR increases or decreases. For example, in the thyroid hormone disorders, in the disorder of thyroid gland, which is markedly influenced by the BMR, and in hyperthyroidism, hyper means excessive production of the thyroid hormone, which increases BMR. So weight loss, that's why weight loss, lot of energy wastage will happen, lot of energy expenditure will be more. That's why weight loss is very easily seen in the hyperthyroidism cases. In case of lower production under hypothyroidism, hypo means under production of thyroid hormone, BMR decreases, hence metabolism decreases. Climatical conditions also influence BMR. BMR rises when the climate is cold in order to maintain the normal body temperature. So our body is subjected to outside climatical conditions. When outside climatical conditions are too cold, our body will struggle to maintain the normal body temperature, hence BMR increases in order to distribute heat throughout the body to maintain the normal body temperature. When the climate is in the warm climates, due to profuse sweating, BMR may increase by trying to reduce the again body temperature. So when human body tries to maintain the normal body temperature, BMR increases. Certain psychological conditions also increases BMR, like stress, anxiety, depression. All this, in all these psychological tensions or worries, BMR increases. So all of these factors which are going to influence the BMR. Okay, now you know that what is BMR and what are the factors affecting BMR and how to calculate the BMR. To decide the total number of calories to consume on the daily basis, you need to firstly know how many calories are needed for the BMR. So after calculating BMR, you can decide how many calories need to be given or can be reduced in order to maintain normal body weight. So especially it will be helpful in the person who want to reduce body weight and while treating the hormonal disorders, etc. So there are some foods which also boost your metabolism. Some citrus fruits, green tea, yogurt, and especially protein rich foods like soya, almonds, beans. So some spices like cinnamon increases BMR. And while your BMR is sluggish in the hypothyroidism cases, so one can include the foods which boost their metabolism, which help them to increase the BMR levels. I hope this video was useful for all of you, and thank you.